We were prepared. We had Ebola in 2015, and we realized how vulnerable Lagos was. And I worked with the previous Commissioner of Health, Dr. Jide Idris, during that period. And when we contained Ebola, we sat down and we said, wow, this was a close shave. If we hadn't brought it under control, Lagos as a mega city with 20 plus million people living in very close proximity, any contagion would spread like wildfire and be devastating. And if we haven't learned anything from Ebola, and something else comes, people will ask the question, what did you learn from Ebola, and why are you so vulnerable, to the next event? From 2015 to 2019, we continued to build infrastructure. The WHO was saying, expect a pandemic. They called it Agent X, which means you don't know what it's going to be. It's going to be something that will just emerge out of nowhere. So we were prepared for Agent X. And we were building human resources, we were building infrastructure. And lo and behold, 2019, Agent X appeared in the form of the novel coronavirus called COVID-19. So we had the infrastructure, we had the staff, we had the training. We'd run a number of simulations already. So when we saw COVID-19 emerging in Asia, and I was the newly appointed commissioner, I just spoke to the governor and I said, look, this thing is going to be big. We need to prepare. And we need to set up, this is the time for us to activate our biosecurity roadmap. And he said, let's go for it. And that's how he became the incident commander, which means you elevate the response right up to the highest political level, which is the governor himself, through the cabinet. It was very easy for us to mobilize resources, and the governor made the decisions. I implemented the decisions. There was a command and control structure, and so we were very nimble. We were able to modify our policies almost on a day-to-day basis, and so it became very easy for Lagos State to respond to COVID in a very proactive way. And when you know your weaknesses, it's better to be on the offensive rather than to be on the defense. So we attacked COVID at every point in time. From each of the 4 waves we've experienced, we were always on the attack, which made our waves very short-lived. So we had fewer deaths because we were on the attack. Yes, the virus has a different profile in Africa, but nonetheless, if a number of people did die, and our doctors saved thousands and thousands of people's lives in Lagos. So if we weren't prepared, that wouldn't have happened. Controlling the public, informing the public. There was lots of misinformation. There was lots of fake news. There was a lot of panic. So the job of government was to reassure the people of Lagos and people of Nigeria, since we were the epicenter consistently, that, okay, this is a serious problem, but we're in control of the situation and we're going to do our best. If you just follow the guidelines, you should be okay. And so we kept coming out into the public space, kept informing, kept talking to Lagosians and Nigerians and calming them down and reassuring them that, it's a major problem, but, the government has this under control. We tried to lock down in the first wave and realized that was a big mistake, and so we didn't do that again. But we controlled it because it's important that you keep the economy open. Otherwise, you will have consequences that are even more severe than the COVID virus itself. So Lagosians earn their living from day to day. So you can't lock down a city like Lagos. And Mr. Governor was very clear about that. We must keep the economy rolling. People must continue to earn their living on a day-to-day basis. So we managed the public health crisis in the context of keeping the economy open, and I think that was a success for Lagos. No, not at all. There's no time to relax your guards. The virus has not gone. It's still around. It's still causing problems in different parts of the world. What we need to do is be mindful and be diligent, but to keep, as I said, the economy ticking and rolling, but obey the guidelines and be each other's keepers. And, as long as the citizenry of Lagos are compliant to the guidelines, then we'll be okay. But COVID is still around, and we need to keep vaccinating, and we need to be diligent about the new variants that are emerging around the world.